Hey guys, I'm back with another episode of Mental Wealth. This podcast is used to express thoughts, experiences, and lessons. I aim to be as transparent as possible. If you enjoy an episode, please don't forget to like, comment, and tell a friend. Thank you. Hey everybody, welcome back to Mental Wealth. In today's episode, we plan to talk about the importance and challenges of finding the right therapist. I'll be interviewing my clinical supervisor, Tyeekia Blue.
Hi.
Yes, ma'am. Yes, ma'am. What led you into the profession of being a therapist?
Well, it started when I went to therapy myself for the very first time. And that was probably back in, I think, 2009-ish, and did unfortunately, go through some grief that happened, in my family. And I didn't know how to navigate or deal with it. So that was my very first time going to therapy. And so I think that's what kind of opened the door for that. And then, typically, sometimes people may go to therapy during different phases of their life. And so I also found myself, seeking a therapist when I found out I was pregnant with my first child. And I was terrified, scared, didn't know, was afraid of, not wanting to be overbearing, to my child, didn't know what I was having at the time. And so when I went to my therapist here in Charlotte, I think that's what really planted the seed, and it was so helpful for me.
That's great. That's great. Why is finding the right therapist so crucial for your mental?
It could be hard. I think a lot of times, most people just don't know, where to start, what to do, how to navigate, finding a therapist. And so I think it is, crucial, but I think a lot for the longest time, mental health was a big stigma. And most people, didn't want to seek help because they didn't want to seem, like they were fitting a stereotype as if, maybe there's something wrong with them. Maybe they're considered to be crazy or whatever the case is. So a lot of times I think it, it in the past, it was a lot harder, but I would definitely say, especially during COVID time, it was more people became more open and talking about finding a therapist or utilizing therapy service.
What are some common misconceptions that you encountered about therapy that stop people from getting help?
There's so many. A lot of times, one of the biggest things, especially if it's someone who's never been to therapy before, is so they're basing their knowledge on therapy maybe based upon something they've seen on TV, something they've heard, just a misconception that they have in their mind, right? So a lot of times, the biggest thing is people worry about what therapists will think of them. So a lot of times they continue to mask how they're truly feeling and not really, then another big exception is, people feel like a lot of people just don't like being vulnerable, and a lot of people don't want that stigma on them, like again, that they feel like something is wrong with them. And quite frankly, a lot of times people, like there's many different types of, this, right, psychotherapists or whatever the case is. And so sometimes people mix therapists up with psychiatrists, right? And so they assume that if they go to a therapist, they're going to be placed on medication and, suddenly they're going to be a zombie. It's just all types of things that people may think when it comes to seeking therapy for themselves.
Do you care to explain the differences between a psychiatrist, a psychotherapist, and just a
Mhm.
pastor and so forth?
Yeah, that's a good question. So when I initially first went to therapy, I did go to therapy that was through like it was like a Christian counselor, right? And so I don't quite remember what her expertise was or her licensure, right? But she was labeled a Christian therapist, right? So that meant that she was incorporating Christian beliefs and values into therapy, right? And so there are such things as, Christian counselors who may have went to school for counseling and they, may specialize in, helping people who want to, work on therapy from a biblical lens, right? Um, And then there are people like me who are considered to be psychotherapists, right? But most people just say therapists; they don't say psychotherapist. But like, so there's many different licensure types, right? So something different. But I'm considered a licensed clinical social worker. Um, and so what that means is that, obviously am a social worker, master's of social work. And then I, worked really hard to get my license, right? So that requires, obviously going to school, over 3,000 hours of clinical supervision plus passing, a very extensive test, right? And so there's that type. And then there's also like licensed counselors. Again, they call it something different every state, but basically it's like an LPC. Also able, they just went a different route. Instead of getting a master's in social work, they may have gotten a master's in clinical counseling, right? So, but they're able to do the same thing. They're able to, focus on, diagnosing and treating mental health disorders, right? And then there's also licensed marriage family therapists too. Also, kind of, they go to school, they get their licensure, similar process, but they focus on marriage and family therapy, right? I'm sure I'm missing some, but those are the biggest ones that I can think of when it comes to therapists, right? Different types, right? And then for a psychiatrist typically they're gonna, diagnose, and they're not typically providing therapy. They're gonna do like an initial assessment, they're going to diagnose, and then typically if they feel that, it could best help someone to also be managed with medication, they're able to prescribe medication. So that would be typically like an antidepressant medication for, anxiety, or sometimes like a mood stabilizer. Like they're the ones that manage that medication. So people who do, get medication from a psychiatrist are also typically also seeing a therapist. So they work hand in hand, usually not, one without the other.
Man.
I guess I forgot psychologists too, because
Oh
some
yeah.
people confuse psychiatrists and psychologists. So psychologists, sometimes you can see psychologists in schools. Psychologists are also able to diagnose and treat. A lot of times they may be the ones that are diagnosing ADHD. Sometimes I believe they can also diagnose autism, but they also can do, talk therapy as well. But they do not prescribe. Typically, they don't prescribe medications. Usually the psychiatrist or the medical doctor, the MD.
Do you care to talk about general practitioners and primary care physicians and how people can go to their doctor's appointment and get anxiety medicine?
That's a good point too, right? Because some people don't know where to go, they don't know where to turn, right? So they're like, okay, well, because most doctors nowadays, even I just went to my primary care doctor yesterday for an example, and before you go for your annual physical, they typically should give you like questionnaires, right? That, one questionnaire may be the what's called the PHQ-9, and that one is screening for depression. They also may do a GAD-7, and that one is screening for anxiety. So if you're answering questions on that questionnaire and it may show that you're displaying some signs and symptoms of anxiety or depression, they may talk to you and say, hey, try to get a better idea of what's going on. And a lot of times they will, start you off on a dosage for either medication for anxiety or depression, but they're going to refer you out to a therapist, and a lot of times they will refer you out to a psychiatrist that can also help manage that medication. But some people, just to get started, because they don't know which way to go, they've already established a relationship with their primary care doctor. They can let their primary care doctor know that, hey, work is really stressful. I don't know which way to turn. I'm dealing with all this financial stress. I feel like my anxiety is at all time high. Is there anything you could do to help? And they are prescribing usually like low dosages of medication, to help manage and get you to a point where you're able to get an appointment with a therapist. Mm-hmm.
How do you think therapy can address a wide range of issues? I mean, from stress, anxiety to trauma and personal growth. How do you think therapy addresses this?
Yeah, therapy can address all the things, right? So when you go, if you do schedule an appointment with a therapist and you have your after you have like a consultation, right? That's talking over the phone with the therapist and kind of talking about the main issues that you want to address. The next step is usually talking with, doing the initial assessment, right? And so during the initial assessment, the therapist should, it could take one or two sessions to do the initial assessment, right? But the therapist should be getting an overall view of everything that's going on, in your life, the things that have happened in the past, including past trauma, as well as things that may have happened in your childhood, and then, focusing on, what's going on today and presently, right? A lot of times people can't really focus on the things that's happening now until things in the past have been addressed, right? So, therapists can address all the things, but my favorite thing to tell people is that I only know what you tell me. Of course, I'm clinically trained to dig deeper. So if I do feel as if you're holding back or you're not, being completely open and honest, then I do can find ways to, ask open-ended questions and, trying to find ways to dig a little deeper. But if people are being guarded with their therapist, then they're not really going to get very far. So a therapist can address all issues. And depending on a therapist, license, like I'm a licensed clinical addiction specialist, along with being a licensed clinical social worker, I can also address, issues related to addictions, right? Whether it is alcoholism, whether people are struggling with taking prescription medications, or even if people are struggling, with, you know, feeling like they want to stop smoking meaning marijuana, or, meaning like they find themselves feeling stuck. So it's just you and your therapist can talk about anything. It should be considered a safe space.
Yes, ma'am. People face a wide range of barriers when looking for a therapist.
Mhm.
The most I've seen from the start is usually financial challenges and insurance. Do you care to talk about this?
Oh, yeah, that's true, right? So most people, the biggest barrier is finances, right? Some people may be self-employed, some people may work part-time, some people may not work at all, right? Some people may work full-time but don't understand their benefits. So it can be a big barrier to find someone that, is not going to break the bank, right? Because let's say, for instance, you do find a therapist and their out of pocket cost is over $100. That's not realistic for most people, right?
Yeah.
Most people cannot afford to pay someone over $100 each session. So they're going to typically go in, and maybe in the moment, if they feel like this is their last resort, only place that they can find, they'll go in and get the support that they need, and then they will stop coming, right? And that's not helpful, because there is therapists develop treatment plans to address all the issues that's going on, and goals and objectives and things like that. So it can be really hard. And so with that being said, there's all different types of resources. I'm sure we'll touch on this, on how to help find, different therapists that could fit your budget needs. So for example, if you do have Medicaid, for example, so that means that you're typically not coming out of pocket for anything, then you can find a therapist that accepts your Medicaid plan. And people sometimes don't know this. If you do have a Medicaid plan or commercial insurance, you can again call your insurance company and ask them to help you get a list of therapists that's in network, that's accepting new clients, and that's located near you, whether you want to do in person or if you want to do telehealth, right? Most people don't think to call their insurance company for anything unless it's billing related, but the insurance company does have an active list of therapists who accept your plan, and therapists have to recertify usually sometimes every 6 months or a year with different insurance companies. So all that information should be up to date. So that's, one thing. And sometimes people, again, may not have insurance at all, so they need to go about doing self-pay. So there is different resources out there, such as Open Path Collective, where there is a list of therapists who are accepting clients that for self-pay rate, and it will just straight up tell you like what the rate is, right? So I believe the last rate I've seen on Open Path is $60 per session for a licensed therapist. And then if it's a therapist who is provisionally licensed, or that's an intern, a lot of times I believe the starting rate could be like $30 or $40, if I'm not mistaken. But Open Path Collective is a good place to start if you're looking for a therapist in your area that will accept self pay, or if you're fully, I can go on and on, so I'm trying to sum it up. Or if you're fully employed, a lot of times your employer will have what's called EAP, Employee Assisted Program, right? Where your employer will help get you sessions, right? And sometimes some employers will authorize, it's still through the insurance company, they will authorize 3 sessions, 6 sessions. I've even gotten one recently that's 10, and that's through their employer. But it does take time. You do have to reach out to them. And like people are scared, like, what if my employer knows what I'm talking about? It's all confidential. The employer would only know like the session happened, and then, the insurance company, pays for it, but none of the information that you talk about, right? But, there's different avenues like that. So I'm sure we can get into like typical websites to look at when you're looking for therapists that may fit your criteria.
Yeah, we can head there right now. Where do you think people could begin their search for a therapist?
Yeah, okay. So I would say starting off with Psychology Today. I believe it's psychologytoday.com. Just go into Google, right? And I'm sure somewhere we can like kind of post these Psychology Today. You'll see like it's gonna ask you what's your zip code. You put your zip code in, it's gonna be hundreds of therapists, right? Typically. And then you want to filter it, right? You want to filter it to what works for you. You don't want to have 100 lists of therapists and then none of them really work for you, right? Because if therapists are virtual, there may be a lot of therapists in your state, in your area. But let's say, for example, you unfortunately suffer from some type of trauma and you don't feel comfortable having a male therapist, you can click female. Let's say you're a part of different communities. Typically it will have a filter for if you're looking for a therapist that's a part of a different community that works for you. You can even filter it by race as well. Let's say you want to find a therapist that looks like you. There's nothing wrong with that. I never take offense to that, but like some people may feel like, well, what if it feel? No, listen, you want to be as comfortable as possible. So you can filter it by race, and then you can filter it by insurance, right? So let's say, for example, you have Blue Cross Blue Shield, Anthem, United Healthcare, any of those, any Medicaid plans, you can filter it by that as well. So Psychology Day would be my first choice if I'm looking for a therapist, right? Because it has most therapists are all listed there. Again, like we talked about, call an insurance company, and then there's Open Path. Which is for self-pay. And then there's all kind of other resources out there, such as Headway.com. So with headway.com, that is, therapists who are already credentialed with insurance, and they even will have like listed the times they're available, the day they're available is very easy. You go in, you put your insurance information in there, and it will automatically tell you how much you're expected to pay. It's very easy to use Headway as well. Then there's a website called Alma. It's ALMA I believe it's just .com, but again, Google is your best friend and we'll list the websites. And Alma is similar to Headway. You go in, you find a therapist, and a lot of times you can do self-pay. Whatever your insurance is, you'll find somebody that works directly, for you. There's so many different websites out there. I mean, I know there's a such thing as BetterHelp, right? Where BetterHelp, I believe, is less expensive, and you can, from my understanding, some therapists may even do text on that website. I'm not familiar with BetterHelp, but I think that may be something else that people may utilize because they're looking for someone that matches their budget as well. So we'll list a lot of websites. So those are just some to name a few.
Yes, ma'am. How do you determine what's the right therapy or therapist for you?
That's a good point. So most people will pick a therapist that they feel like either remind them or of somebody, or again, a therapist that looks like them. Or you'll have someone who, wants to be, they're already kind of fearful, right? So they want to find someone that, is nowhere near where they currently live, nowhere near where, they would potentially run into their therapist. So they will find someone that, for example, I'm in the Charlotte area. Sometimes I have people located in the boonies of North Carolina, that will find me because maybe they work as an executive somewhere and they're like really trying to find someone that is completely biased, has no idea who they are, and they just want to, continue to feel safe in that space. So, that sometimes, can happen. Some people will base their search on therapists based upon their modalities of treatment. I'll just touch on that a little bit. Won't go into too much detail because it could be a lot. But some people, who've been to therapy before, like a certain modality of treatment. So some people think of therapy as traditional talk therapy. Yes, that's true. But some people like therapists who may do focus on trauma, right? And they want to do something like EMDR. I'm not an expert in EMDR, so I won't even pretend to know, all the things that they do, but they do focus a lot on trauma or brain spotting. Brain spotting is another thing that, some therapists are specialized in and certified in, and that's trauma focused therapy, right? Or some therapists like myself focuses on modalities like motivational interviewing, and that is, trying to help you move through those different stages of change, help you get to where you want to go, right? But slowly removing those barriers out of the way that's stopping you from feeling stuck, right? Or cognitive behavioral therapy, where, trying to reframe your thought process to help you be able to, get to help you be able to cope and deal with, anxiety or stress, or DBT, right? Like that's another modality, right? So some people will look through and try to find therapists based upon their modality of treatment, but there's all kind of different reasons why people find the therapist that they do, right? They just, it just depends, I guess, on the person.
Yes, ma'am. All right. What are some good potential questions for someone to ask their therapist during the consultation?
Yeah, that's a good question. So I would say a lot of times people just, want to know when they're reaching out. They do ask about the therapist, modalities to treatment. A lot of times, obviously, about insurance questions. If the therapist is, willing to meet in person, if that's a desire that you have, or virtual, right? Some people I'm hearing more recently, like where people have explained to me, like they went to therapy before and they felt like their therapist did not give them much feedback. So if feedback is really important for you, then that is something that you want to talk to your therapist about, right? Because some people do just want to be heard. They just want to feel validated. They just want someone to listen to them because maybe they've gone through, they feel like people are always telling them what to do, right? So maybe there's some people who don't want, much feedback. They do just, want to be validated, heard, listened to. And there's some people that, will say, hey, I need you to give it to me straight. I need you to don't sugarcoat it. I need you to call me out on my BS, right? So that could be really important too. So, this is a therapeutic relationship. So you do want, and you don't want to start working with a therapist and then realize they're not a good fit for you, then you have to start over because a lot of times that will make people just forget it, right? So you want to make sure this is a consultation. That's your time to make sure that that person is the best fit for you. It's like an interview process, right? Sometimes that's how I like to think about it for the therapist and for the client, right? Because some therapists may recognize early on, like, okay, maybe this is not the best fit for me either, right? And I do know someone who would be a better fit for you. Here, let me refer you to them because again, you want to make sure it's a good match.
Yes, ma'am. Yes, ma'am. What is the 988 number?
So with a lot of times, I absolutely do want to mention, like we're talking about how to find a good therapist and a good fit for you, and sometimes that takes time, right? That means that you are, looking, you're searching, you're scheduling consultations, you're finding the time that works for you to do the consultation, you're, doing insurance verifications, and sometimes that takes time. So you may reach out to a therapist. Let's say they don't have any availability until next month, right? That can happen. Some therapists may have a wait list. You may reach out to a therapist and, they may not have availability for the next, 2 weeks, but you really need to talk to somebody right now. Like you're on edge. You don't know, how you're going to keep moving forward. You don't know what you're going to do, right? Your dark thoughts are creeping in, and some people may unfortunately say things like they don't feel like they can even move forward, right? They want to go to sleep and not wake up, right? Some people may be in that space. They may have not sought help for the past 10 years after dealing with one thing after the next, and they're at their breaking point, right? So if that is the case, if you do find yourself having dark thoughts or thoughts that make you feel like you don't want to be here, and you are maybe thinking of a plan or something that would, cause harm to yourself or even others, then, want to play it safe. And there is the suicide hotline. They made their number into a number that's easy to remember, which is just 9, right? You can call them, you can text them, and they will have people there that can help, guide you, talk with you, and help you, right? It's not meant to be, your therapist, right? Where, you're reaching out to them every time you have a crisis, but it is meant to be that resource that you can need in the moment to help you. And a lot of times they will give you resources. They can also provide lists. And then if they do, they have protocols too. So they really feel like you need immediate help. They may, encourage you to, go to your nearest hospital or call 911, right? That is always an option too. So if you do find yourself like, I need help right now, I don't know if I'm gonna make it, I don't want anything bad to happen. Whether they do go to the hospital by reaching out to 911, or they simply have them drive themselves or have a loved one drive them to the hospital and let the hospital evaluate them. And a lot of times, if the person does need immediate help, they need to stabilize, and sometimes they may put them on, temporary hold just to make sure that they're safe and the people around them are safe. So that is an option. I know that's something we don't like to talk about, but it's important. There's help out there. Every county typically has a crisis hotline as well, so you can always look up crisis hotline in Greenville County, crisis hotline in Mecklenburg County, whatever your county is. But if you can't remember any of that, please remember 988 and obviously 911.
Yes, ma'am. There's a lot of resources for finding affordable therapy. What's the sliding scale?
Yeah, so that's a good question. The sliding scale is basically based upon your income, right? I mean, for me personally, as a therapist, I'm not asking people to provide me paycheck stuff. Again, if you start off, deciding to lie to your therapist, then again, that's on you, right? You're not gonna get the best experience, right? But let's say, for example, someone, comes to me and they say, "Hey, you know what? Barely making, $15 an hour. I can't really afford, therapy at the typical price, right? Do you offer a sliding scale?" And I would say, yeah, I do offer a sliding scale. So my sliding scale does start off at $60, right? So let's say, for example, someone, maybe in between insurance, but they do, make pretty good money. Let's say they make $70,000 a year or whatever the case is, then, they're not going to sliding. It is a sliding scale. So it's based upon your income. So their price may be $70. There's no one that's ever paid for a sliding scale for me personally more than $80. Because again, wanting to be realistic, and not something that, again, it's going to break the bank. Want you to be able to get the help that you need. And there are some community mental health agencies in your area. Type in community mental health agencies, and they sometimes offer pro bono, right? It doesn't hurt to ask. You can let them know, I don't have Medicaid, I don't have income. Is there anyone in your agency that's offering pro bono services, meaning there's no fee at all? So they're willing to see you at no charge, right? So that is also an option. You'll be surprised. There definitely is, quite a few therapists. I have people on my caseload that are at pro bono, right? I do determine like how many patients or clients I could see at a pro bono with no fee. And, it's not something that I, advertise. There are some people that just need the help and, just want to make sure that they have the support that they need without having to worry about, paying out of pocket.
How does somebody communicate openly and set goals with their therapist?
Yeah, that's a good point. Some people come in with a list, right? They come in, they have their notebook out, and they're like, I want to work on this, and that. They're like, do you have homework? Is there a book that I can read? Is there an app that you could recommend? Is there this? Is there? Like, there's some people that come in and they're like, I'm ready to do the work. I'm determined, right? I want to get past this point. And, there's some people who are barely making it, right. They're holding on by a thread. So, typically therapists does have a treatment plan, and that's how the therapist, can measure if the client is making progress on their goals or they're staying in the same place or regressing, right? So the therapist is the one that typically is setting the goals, right? So that is definitely one way, but it just depends on the individual and where they are in their life, right? Some people are receptive to, additional resources that the therapist may provide. Some people will, the thought of having to do anything between therapy gives them anxiety, and they just like, I just want to come here and talk, right? So it just all depends on the therapist.
When should somebody consider switching to therapists if it's not the right fit?
Yeah, sometimes some people can decide to switch to therapists if they do notice that there's some people that will tell me like, I felt like my therapist wasn't really listening to me, or I felt like my therapist, canceled our sessions a lot. And those sessions, mean a lot to me. Or if they feel like the therapist isn't really engaging, or the therapist isn't maybe, unfortunately, recalling information that they've already shared with them, right? No therapist is perfect. But if you do feel like those things are happening, then it could be a good idea to switch therapists.
I know patience and persistence is very important in the therapeutic process. Do you care to talk about this?
Patience and persistence on the therapist end or the client's end?
Both.
Both. Okay. So patience and persistence, like a therapist is trained to be patient, right? Therapists are trained to not take things personally, right? And, to help a client despite how long it may take them to reach their goals. I mean, there are some people, again, that will come in, hyper focused, determined, and ready to make the change. And there's some people, it may take them years to get there, right? I have some clients on my caseload that, I've been working with them for the past 4 years or so, and that's okay, right? There's no set time frame in how long it may take a person to get to their goals. There are some people that may walk to therapy and assume the therapist can like take a magic wand and fix them, right? It doesn't work that way. There is it's both people are working together collectively to reach the goal. So don't assume that a therapist can magically, fix your life, within the first 1 to 2 sessions, right? It takes time, and all the years it took for these things to happen, and especially if there's past trauma, right, it's going to take some time to really move past those things, set healthy boundaries, come up with good coping skills, put these things into place. It takes time.
Do you have any final words for the audience?
So I would just say that, I know starting a therapeutic journey can be really difficult. I know there's stigmas out there about mental health. I know that you don't want to feel like you're being labeled, or some people don't like to feel like they're being diagnosed, or they don't like to feel as if something is wrong with them, right? I would say most good therapists have their own therapist. So even though, therapists are trained in doing, well to help their clients, they're also making sure they work on things in their life, right? It's always a process, right? I'm sorry. I always say, progress over perfection. So my thing is that, if you do have things that you want to work on, then it's always good to have someone that's unbiased, different than a friend, different than a parent, different than, cousin or, spouse or whatever the case is, that's able to help you navigate your life difficulties and troubles and things that may have happened.
Yes, ma'am. If you enjoyed today's episode, please don't forget to like, comment, subscribe, and I'll be back with you for another one. Peace.